If we don't know who we're caring for, when we've seen them, where we've seen them, we aren't going to be able to manage the quality of this process. Logistics is not limited to the movement of supplies and response personnel. We need to understand that patient tracking before, during, and after an event is a critical component to the whole business of logistics and logistics information management. One of the critical important pieces of this is registering who you're seeing, where you're seeing, and what you've done to them. Some states have showed great innovative thought processes about this and are using existing demographic databases to register people. For instance, Tennessee, when people came in for their vaccine and for their Tamiflu, they would swipe their driver's license. That would allow them to know who they'd seen and their zip code, etc. This is an important set of innovations. It has to be done consistently. If we don't know who we're caring for, when we've seen them, and where we've seen them, we aren't going to be able to manage the quality of this process. I think secondly, we need to have an information exchange that links those patient registration data sets that are being generated locally into a nationally accessible one, HIPAA protected, privacy controlled, all the right stuff, but accessible in a variety of locations. I think now about people in Katrina who moved from New Orleans to Houston, or New Orleans to Little Rock, New Orleans to Salt Lake City, and the receiving end, knowing where they had been seen, what had been done to treat any medical issue that they had, was not transparent at all to those on the receiving end. I think the other thing that's moving forward now is the linkage of this patient registration data to electronic medical record data, with Medicare and Medicaid putting an additional amount of money now into the expansion of electronic health record use and development. That's going to allow us to have a much better access to what the chronic diseases and medications are of the patients that we're seeing. So if we can link that registration then to their electronic health record, we're going to be able to practice our medicine much more soundly, rationally, and with continuity of care. This will take leadership in the medical and public health communities working collaboratively, because they both have interest in this process and they both need to be on the same page. That's been occurring and it's showing real movement forward. If we're going to make this a true national system, however, it's going to require a national approach to how we will fund the development of this in a comprehensive way.